Have you ever wondered how doctors figure out if someone has a particular illness, especially one that might not show obvious symptoms right away? It often involves careful diagnostic testing, which is a big part of how medical professionals can ensure proper care. This is especially true for conditions like tuberculosis, commonly known as TB. Hospitals perform tuberculosis tests using several reliable methods to detect the presence of the TB bacteria, which can cause either a latent or an active infection. These tests are essential for accurately diagnosing the condition, allowing for timely treatment and preventing further spread. The initial step usually involves either a skin test, called a tuberculin skin test or TST, or a blood test, known as an interferon gamma releases assay or IgRA. The skin test checks for an immune response by injecting a small amount of protein derivative under the skin and then observing the reaction after 2 to 3 days. The blood test, such as quantiferon TB Gold Plus, measures the immune system's reaction to TB bacteria proteins in a laboratory setting, offering a single visit option. If these initial tests are positive, further diagnostics like a chest X-ray are often ordered to look for signs of active disease in the lungs. In some cases, a sputum test, which involves analyzing a sample of mucus coughed up from the lungs, is performed to confirm active TB and identify the specific strain of bacteria, guiding treatment choices. If you think you might need a TB test, you will typically start with a consultation with a healthcare professional. They will review your medical history and assess any potential exposure risks. Depending on this evaluation, they will then order the appropriate initial test, which could be a skin test or a blood test. After the test is administered, you will receive instructions on how and when to get your results, which might involve a follow-up appointment to read a skin test or a call about blood test results. Should the results indicate TB exposure or active disease, the medical team will discuss the next steps, including further diagnostic tests or starting treatment plans. It is important to remember that a positive TST or IgR test only indicates that you have been exposed to the TB bacteria and your body has developed an immune response. It does not necessarily mean you have active TB disease. The subsequent chest X-ray and sputum tests are crucial for distinguishing between latent TB infection, where the bacteria are present but inactive, and active TB disease, which requires immediate treatment. Understanding this distinction helps healthcare providers give you the most accurate diagnosis and treatment plan. Ultimately, hospitals provide a comprehensive and systematic approach to TB testing, ensuring that individuals receive accurate diagnoses and appropriate medical care. By utilizing a combination of screening and confirmatory tests, healthcare professionals can effectively manage TB, safeguard public health, and provide peace of mind to those concerned about their TB status. Getting tested promptly is a vital step in maintaining your health and preventing the spread of the infection.